How deadly are shotguns?
Get down.
Well, I don't know, but I'm Dr. Chris, and we gonna learn today. Whenever I hear the word shotgun, that's immediately where my mind goes. Thanks, Arnold. And today, with the help of guest lecturer Garand Thumb, we will determine why shotguns are so freaking deadly. All in the name of modern medical science.
Shotguns. Are they deadly? Are they effective? Where do shotguns fall?
Now, the top comment in Garand's video reads, well, half a soap. Let's hope Garand's ballistic dummies hold together long enough for us to draw some meaningful medical conclusions. Dr. Garand, what type of shotgun will we be using for today's tests?
So today, we're gonna be running a Benelli M4 12 gauge. It is a semi-automatic shotgun and it rocks and it's awesome.
An excellent choice, Professor. And for our test today, Garand has prepared two main types of shotgun ammunition, which are designed to create different wound profiles when they make contact with a target. Slug and buckshot ammunition. Garand, can you show us the inner workings of a buckshot style of ammunition?
We have the primer, we have the powder to of course ignite, and then we have this nice little wad right here. Now these right here are double-aught buck.
That's correct. Tucked away inside the wad in every buckshot shell are 8 to 9 small metal pellets, all 33/100ths of an inch in diameter and approximately 60 ounces. There are other sizes, but double-aught is the most common. Shout out to Lucky Gunner here on YouTube for a great close-up. The wad helps to direct the pellets towards the target, minimizing the spread pattern of the ammunition before it makes contact with the target. Buckshot is like pre-fragmented ammunition, penetrating the target and creating a spread pattern inside the flesh in a wound profile that looks something like this. At 30 centimeters of penetration, the spread pattern begins to become very prominent. The degree to which this spread pattern occurs outside the target depends on the shooter's distance from the target.
Starting at about 7 right here.
Excellent shots, Professor. Before we move to the ballistic dummies, the cardboard targets help to illustrate the optimal range of the shotgun ammunition by clearly demonstrating its spread pattern. And at 7 feet, we can see how effective this weapon may be. Oh, and interns, please note the larger hole towards the upper left is where the wad, which directs the pellets, broke the cardboard. Not the actual double-aught buck.
Very tight at 7 with that Hornady critical defense. We have one flyer there. Very much so under handprint. We're looking at about a 2-inch grouping right there.
Frightening. That's 8 to 9 pellets entering the body at the same spot. In medical literature, the severity of the shotgun injury is determined by the width of the spread pattern, where anything under 10 centimeters at the point of entry is considered very bad. Check out this demonstration in a ballistic gel block by Lucky Gunner.
At roughly 11 to 1200 feet per second, double-aught will penetrate 18 to 20 inches in ballistic gel, which is more than enough.
The average human torso isn't even that thick, and it is easy to envision some of these pellets exiting the body opposite the initial impact via one of two basic exit patterns. One giant hole if the target body is thin enough and the pellets don't have the opportunity to spread, or through multiple smaller holes in thicker targets, or when the trajectory of the pellets is altered by bone and tissue. At close range, all the pellets travel as one unit, held together by the wad until they strike soft tissue. At the moment of penetration, the pellets separate from the wad and slam into each other, creating a billiard ball effect that disperses the pellets forward in all directions. And no, we really don't want high velocity metal pellets doing this inside of our body.
We're at 10 right here. Very good grouping right there. Awesome. Still under a handprint. We're looking at about 5 inches across.
At this range, I would expect a large entry wound. The pellets connect with the target close enough to each other that each one would disrupt the soft tissue around it enough to turn that entire 5-inch section of flesh into mincemeat. These pellets would still carry enough kinetic energy to exit the body anteriorly, but the exit wounds would be more erratic, and the individual pellets would likely to become lodged in the body. When it comes to shotguns, a more pronounced spread pattern isn't necessarily what makes it more devastating.
What makes it so devastating is you're getting hit by freaking 8 to 9 pellets of 60 grains, and it's faster than a 9 mil.
Thanks, Professor. The further away we get from the target, the more pronounced the spread pattern becomes, but that also doesn't mean the shotgun is no longer lethal.
So at 20, pattern's starting to open up a little bit, but still all within the man-sized target right there.
As Garand mentioned, Each of these pellets are traveling faster than a bullet from a 9mm. And well, a 9mm can do considerable damage to the human body. Instead of one devastating blow that explodes the target body apart, you will now suffer 8 to 9 separate bullet wounds.
And it's either is hitting the FBI standards. Out to 50.
As we just witnessed in Lucky Gunner's 25 ballistics gel test, the pellets still go all the way through the block. You can wave goodbye to every internal organ in a 10-inch diameter section of your chest.
You're still lethal.
Unlike in some video games, if you find yourself on the receiving end of a shotgun barrel, you are not safe.
Are you kidding me? Are you kidding me? It's a goddamn blue tactical! Are you kidding me?
Even at ranges of 25 to 50 feet.
Don't you miss when the pump used to kill people?
Especially if your opponent can aim as effectively as Garand Thumb.
At about our max distance of 25 on this little range right here. And we have a good grouping. Again, everything's on paper.
Of course, by on paper, he means lodged ominously in your flesh. Now, the other type of ammunition featured today is a slug, which is designed and behaves very differently.
But with a slug, you simply have 1 ounce of lead. It's a little bit crazy.
And so is the wound profile that the slug creates. Look at this. Massive stopping power amounts to a giant temporary cavity as the slug transfers its force into the target. The thick permanent cavity is nothing to be messed with either. And if you read the fine print, the 12-gauge shotgun rifled slug commonly expands to nearly double its diameter and stays in one piece. Can you imagine surviving a hole in your chest over 1 inch across?
Yeah, it does.
In this test conducted by the Kalkara 131, we see a healthy 22 inches of penetration. That is to say, it's coming out the other side of you and pulverizing any tissue, organ, or bone in its path.
All right, we got 1 slug right here. We'll go ahead and take a shot.
And with the ability to make contact from 80 yards, this type of ammunition is quite powerful. Nice shot, Professor. What's your official diagnosis?
That would hurt. Holy shit, slugs are crazy.
Yes, indeed it would. Now, what do you say we break out the Ballistics Dummies? Designed by Ballistics Dummy Labs, these are fairly realistic human analogs that will allow us to gather scientific data about ammunition impact.
They have bones, they have organ in them, and we're gonna see what it's like when we shoot these and how they perform and what happens.
Now, I believe you'll be starting with some buckshot ammunition.
Double-aught buck versus a ballistic dummy.
Fire in the hole! Initial contact and penetration towards the bottom third of the sternum, dead center. Interns, take note. Sternal fractures were once thought to be high morbidity injuries given the proximity to the myocardium, the muscular layer of the heart, and likelihood of associated injury. Behind this T-shaped bone lies the mediastinum.
Today's topic is the mediastinum. Well, not that bit, it's more that bit, innit?
The central portion of the thoracic cavity, which houses many vital structures. As previously mentioned, that's where your heart is, as well as major blood vessels, essential nerves, the esophagus, and trachea are located. This space also provides a protected pathway for structures traversing from the neck into the abdomen. Among medical professionals, this location is known as Tiger Country. If you've been watching my videos for a while, you'll know that one. And we don't like going into Tiger Country. Ever.
Tight group first off, because we of course have the Hornady critical defense there. And we definitely got into the heart there.
Well, great. Penetrating cardiac injuries after gunshot are usually fatal and are very challenging to manage for surgeons, even in fully equipped centers. Now, there are case reports detailing the miraculous survival of lucky individuals who sustained such wounds. But when a bullet tears through a portion of the heart, there's just so much that can go wrong. A rupture, or laceration, or a contusion, bruising, of the myocardium, which is the muscular layer of the heart. Damage to the interventricular septum, which is a combination of the muscle and the membrane that separates the left ventricle and the right ventricle and allows for proper blood flow through the heart. Cardiac tamponade, fluid or blood buildup in the pericardium. Damage to the pericardium, the double-layered fibroelastic sac surrounding the heart. Laceration of the coronary arteries, which supply blood to the heart muscle. Need I go on?
No! God, please, no! No!
Let's take a look at the back of the dummy.
I can see some of these pellets right there. Oh, and so it looks like it took some of the bone out through the back of the spine right there.
Multiple choice pop quiz. bone from either the sternum or ribs anterior to the spine, or the spine itself bursting out through the back of the body. Good or bad?
1, 2 of the pellets right here that got through.
These pellets aren't small, especially once deformed, and there are 5 or 6 of them lodged in some tissue somewhere inside the mediastinum of our first dummy, whose heart has had a few moments to start bleeding internally.
So we definitely obliterated the heart. You can see the internal bleeding there through the lungs. Oh, gross, blood right there.
I do believe that this is curtains for dummy number 1.
Clearly what we have to do, we're gonna shoot it again. I'm gonna gut shot this guy. We're gonna see what happens. Yo. Oh. Oh no. Oh no!
Penetration below the bottom rib, but above the belly button and slightly to the right. Our patient will sustain major damage to the abdominal wall and small intestine, which are coiled tightly in that region. And the sigmoid colon will likely be damaged as well. Fun fact, the sigmoid colon is named for its S shape and is the section of the large intestine that connects the descending colon to the rectum. Can you guess what is stored there?
Fun facts are not fun!
A gastrointestinal perforation will obviously result in internal bleeding and can lead to peritoneal contamination and infection as the contents of the small intestine or colon leak out into the perineum, which is a tissue membrane that lines your abdominal pelvic cavity and surrounds your abdominal organs. Partially digested food and fecal matter should not be floating around inside the body. As such, a gastrointestinal perforation must be surgically treated as soon as is possible. The success of the operation depends on both the size of the perforation and the length of time before treatment. Both the small and the large intestines are relatively soft, and a cluster of shotgun pellets would tear through them like butter, leaving me extremely concerned for the kidneys, spine, and spinal cord towards the rear of the abdomen or retroperitoneum.
Oh my God! It would look like, due to the lack of resistance, that we got quite a bit deeper, and we also obliterated the spine, so...
Hey Siri, can a person live without a spine?
Okay, I found this on the web for can a person live without a spine. Check it out.
I'm pretty sure that this guy's gonna die. Would you agree, Micah?
He dead.
Yeah, I think he's dead.
This patient has experienced severe damage to the abdomen and the lumbar spine, where the spinal cord may very well be injured or even severed. If the patient is extremely lucky and does not die from immediate blood loss, we will need to conduct emergency surgery and run some tests. Oh, and we're assuming that the previous wounds didn't occur. An exploratory laparotomy, which is a surgical incision into the abdominal cavity for diagnosis, will allow us to determine the extent of the injury to the abdominal organs and perform a general debridement of soft tissue injuries that have occurred. Some problems, such as gastrointestinal perforations, must be repaired immediately. Any damaged blood vessels will also need to be managed as we prepare the patient for further testing. I'd be concerned for the inferior epigastric artery and vein, which are located towards the right side of the abdomen where the pellets penetrated. But the reconstruction of the abdominal wall may have to wait, as it may be necessary to access the spine through the front of the body depending on the extent of the injury. A combination of X-ray, CT, and MRI scans may be necessary to determine the extent of the damage to the spine, as well as show us where the shotgun pellets are now located. Surprisingly, spinal shotgun wounds are commonly thought to be stable. However, there is potential for acute and chronic spinal instability if the bullet passes transversely, fracturing either both the pedicles or both facet joints. Stable fractures can usually be treated with bracing and rest. Unstable fractures usually require surgery to help realign the bones and prevent spinal cord or nerve injury. Now, of course, you could just Y-strap it and this patient would be just fine. Just kidding, just kidding.
How would you describe that?
Oh, so weird, I don't know.
In this case, I would put my money on reconstructive surgery, depending on what is left of the vertebrae to reconstruct. Unfortunately, there's no way to reverse damage to the spinal cord. Studies show that in approximately 1/3 of spinal injuries caused by gunshot wound, the bullet, or a fragment thereof, is retained within the canal. We can also determine the severity of spinal cord damage by how much or how little motor sensory function remains in the lower spinal segments of the victim.
Wiggle your big toe.
A complete spinal injury is defined as one where the patient lacks motor and sensory function in this region, the result being paraplegia. Luckily for this dummy, however, patients with injuries to the thoracolumbar region compared to the thoracic and cervical spine have the greatest chance at recovery, and approximately 1/4 of individuals are able to ambulate 1 year after injury. At least this patient has one thing working in their favor.
I'm gonna shoot this guy in the left lung. We haven't really hit that yet.
Oh, my mistake. I was assessing the damage before the battle was over. What was I thinking? Shattered collarbone, several broken ribs at least, a punctured lung, and resulting pneumothorax, possibly lacerations to the subclavian and axillary arteries, which supply oxygenated blood to the bilateral upper extremities with contributions to the head and neck. And the lateral aspect of the thorax, the axilla or armpit.
Sometimes when I get nervous, I stick my fingers under my arms and I smell them like that.
And the upper limb respectively. That's a lot. If the shoulder anatomy were present in this ballistic dummy, I might expect to find a fractured shoulder blade or scapula as well. Not to mention all of the damage to the musculature in the area and possibly even the brachial plexus, the location where all the nerves of your upper extremity meet.
You can see the actual wound tracks from the pellets right here. So it looks like we had about 4 that made it completely through and just about dumped out.
Depending on distance and the trajectory inside the body, the bullets may exit the target through multiple locations opposite the side of the initial impact.
I think the only way to finish this guy off is to do like 4 rounds rapid fire into his chest and to see what happens, right?
I'm sorry, what? No one is surviving that. Thank you for donating your body for science. Professor Garand, how can you take it up a notch from here?
We're gonna be firing the 3-inch Magnum slugs. I think that these are gonna have too much power. I think we're gonna see a lot of over-penetration.
Or need I ask? At higher velocities, powerful rounds like these may slice directly through the target. And a slug that stops inside the target causes maximum damage. Even suboptimal performance on an unprotected human target is...
Oh!
Terrifying. A solid hunk of metal traveling with enough kinetic energy to shatter bone and continue forward. With the buckshot, when initial contact was made with the sternum, many of the pellets stopped or were deflected. But the slug crushes through the sternum, snapping what appears to be the 3rd and maybe the 4th rib on the left side into the mediastinum and possibly exiting through the other side of the body. What do you see, Garand?
I think he's dead. Okay. Oh yeah.
Yeah, dude, that's broken.
That sliced right through.
Yep.
That is the slug impact right there. This is the slug right here. Points where it scraped along bone and stuff, but that came through as a solid chunk.
Anything that large that shatters the spine will definitely eradicate the soft bundle of spinal nerves inside. At the level of the thoracic spine, if a Christmas miracle occurs and our patient survives, this will result in paraplegia, though to a degree further up the body than in the previous dummy. But I don't think this dummy will need to worry about that. The heart is right behind our 3rd, 4th, and 5th ribs, slightly to the left of the sternum. Exactly where...
Oh!
I believe heart tartare is the correct culinary term. Is anybody hungry? But seriously, he's not getting up from that. The only logical answer...
We're gonna go ahead and we're gonna do a gut shot on this guy.
I'm on you, man.
Well, interns, everything that was bad about penetrating abdominal trauma when we spoke about it 5 minutes ago is still wrong. Only this time, I'm more concerned for the spine. That slug really packs a punch.
Yeah, we actually blew the stand apart. Okay.
And if the stand directly behind the dummy exploded, then...
like I said, this thing just has a lot of power, but that did obliterate the spine. You can see, even though it wasn't dead on, it still shattered.
If I had to choose between this gut shot or the previous shot to the sternum, I would choose this one because there would be a very, very small percentage of surviving this one. You know, given the fact that a gut shot doesn't explode my heart. Unbreak my heart. What about you, Garand?
The question is, how do we finish this off? Do we just put like 3 rounds of Magnum through this guy at once?
What? That was definitely sudden. But should I have expected anything less from the Garand Thumb? Truly an unstoppable force moving in the direction of science. Thanks for watching, and I hope you enjoyed the video. If you like it, be sure to subscribe, and if you didn't, be sure to let me know why in the comment section down below. As always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.